Today on The Real Story, COVID vaccines are now going into the arms of children ages 5 to 11. Health experts say this is a big step in protecting our communities, and it's expected to make a difference for schools. Joining us this morning to talk about this latest development and to give us a rundown on how the school year is going so far is Bloomfield School Superintendent Dr. James Thompson. Then the pandemic has taken a toll on our children, and schools and parents are seeing an increase in mental health problems. State Representative Liz Linehan, who co-chairs the Committee on Children, will join us along with Ben Shaback, a social worker in Cheshire Public Schools. What resources and advice are out there for parents? It's all today on The Real Story. Good morning, and thanks for joining us on The Real Story. I'm Jen Bernstein. After a very long wait, kids ages 5 to 11 can now get the Pfizer COVID vaccine. And Connecticut wasted no time on the rollout. Shots were going into arms immediately after CDC approval. Now, this is a big deal for parents and certainly a big deal for schools. Many districts planning on holding clinics to help kids get their schools vaccinated. It's a big milestone considering all of the challenges our students and teachers have faced. COVID pushing remote learning and missed classroom time, and then the adjustment to coming back and learning in person this year. Joining us to talk about all of it is the Superintendent of Schools in Bloomfield, Dr. James Thompson. Good morning, and thank you so much for joining us on The Real Story.
Thank you. Thank you for the invite.
Of course. Great to have you on. So, Dr. Thompson, give us an idea of what these vaccines mean for the school district.
Well, we hope Bloomfield families take advantage of the vaccination clinics that will be made available to our 5 to 11-year-old students. Clinics are being offered at Comedy Race School on the following Wednesdays, November the 10th, December 1, December 15th, and January 5th. We anticipate an increase in vaccinated students will reduce the number of positive cases and also the number of students having to quarantine.
Yeah, I'm sure that has disrupted being back in person at points, right? And I think kids, if they start getting immunized now, should be good, what, by a little after Thanksgiving or even Thanksgiving at this point?
Yes, I mean, from what I've heard, the kids will be able to start getting vaccinated as early as, next week.
Yeah,
and that definitely will have an impact.
Yeah, and we've even seen kids already getting vaccinated now as this taping is going on. So they definitely have started. How impactful has COVID cases and the need to quarantine to keep kids and staff safe been for you with Bloomfield? Is it something you're having to juggle on a daily basis? Has it interrupted classroom time a lot this year?
Yes, it has been disruptive because it has a lot to do with, when you do the contact tracing, to the extent students have been in contact with other students, other adults, that determines the level of quarantine that has to take place. So it's quite a challenge because you have to go through that process that I just mentioned and determine who has to be quarantined and how long.
When you found out that the CDC and the FDA approved the Pfizer vaccine for kids ages 5 to 11, was there a sigh of relief in your office, or what was that reaction like, considering it's going to make a change moving forward for what you all have to do?
Yes, I think it will make a tremendous impact relative to, as I mentioned earlier, the reducing the number of positive cases that our students are experiencing. And also, again, not to be redundant, also it reduced the number and the extent of quarantine.
Sure. So Governor Lamont had just put this out on, I think it was Thursday, about this Screen and Stay initiative. And under this initiative, they say students and staff identified as having close contact with someone who has a COVID case, but who are not fully vaccinated yet. We're talking about kids, obviously, because they weren't able to be vaccinated until just now, that they're going to be able to remain in school if they were wearing masks in these circumstances and if they don't develop any symptoms. I know this news just came out. What's your reaction from the school district's point of view, or are you still processing what this means?
Yes, we just received the information, and we are in the process of processing this with our district team, as well as we will be meeting with our school leaders, principals, and staff. And also we will be getting information out to families about this new initiative from the governor.
Yeah, communication's so big, of course. Tell me, how are kids doing this school year? How are they adjusting to being back in person after remote learning and all that 2020 was?
You know, children have proven to be adaptable and resilient throughout this pandemic. They are adjusting well, as evidenced by the high attendance rates, students' classroom engagement, and also feedbacks from families. I'm very happy with the adjustment of our students that they've had to make to being in person fully.
So you feel like it's been really good for them to be back in person with teachers in a learning environment all day?
Yeah, no question about it.
What kind of gap have you seen from the remote learning that you all had to navigate last year? I mean, a school district like Bloomfield has made such leaps and bounds. I mean, you all have done such a good job in the last several years. You've gotten a lot of recognition for it. So did this set you back? How did you all get through this? How did you navigate this challenge?
Well, you know, that's a very good question. We have kept our focus on the academics, even when we were doing remote learning. We now, our teachers are making up for the lost ground by accelerating learning, providing extended learning opportunities. And these include summer school programming that was offered to students entering kindergarten through grade 12. And this year, with the robust summer school program offering that we had a new component, and that is to have summer school for our 3- and 4-year-olders, many who will be entering kindergarten, to get them prepared. We also have extended day programs that includes academic enrichment activities, and we will soon be offering Saturday academies throughout.
And are a lot of those new from COVID? Those weren't in place before?
Well, in the past, we've always had extended learning opportunities, but as a result of COVID, we have increased those opportunities in terms of our Saturday academies, and also in terms of the extended day. It includes not only the academics, but it also includes the enrichment activities. So it's much more robust now than it was prior to the pandemic. And as I mentioned about summer school, the summer school was much more robust this year for obvious reasons. Mm-hmm. There's a lot of ground that we feel we have to make up.
Where are you seeing the biggest gap in learning? Where are you trying to focus efforts?
Well, our focus will be on reading and also math. Those are the two key areas. This year, two things we're doing this year, we've aligned our curriculum among all our schools, and we're implementing a new reading and math program in grade K through 5.
Interesting. Okay, so how much did the COVID relief funds, all these new programs or these expanded programs, were you able to do that because of the COVID relief funds, or what role has COVID relief funds played for the Bloomfield School District?
Well, those funds allowed us, first and foremost, we utilized those funds to invest in our district plan of excellence. That's our district improvement plan. We're using those funds, obviously, for some of the things that I've already mentioned about summer school, about extended day, allowing us to invest in a new reading and math series, professional development, all those kinds of initiatives and programs that we have in place, and we've been able to expand for children we're using those funds for those areas.
I got to ask, you've been an educator for a long time. I mean, we have up, a little bio that comes up when you're talking, and it says over 50 years in education.
Yes.
And this,
Yes.
2020 and even this year are unprecedented. In your long and storied career here, compare it. Like, has there been anything else, any other challenges, any other year that you've looked at and you've said, oh, that can compare?
No comparison. When we had to transition back in March of 2020, when we had the lockdown and we had a transition to remote learning, that was a complete game changer. Because number one, we had to create the platforms to do it. We had to, number one, really show up with the technology. There was a lot of training that was required to do the remote virtual learning effectively. A complete game changer. Nothing like anything else that I've experienced in my career as an educator.
What is it like to have to, get through it and to adjust? I mean, you can't plan for this. You can't prepare for it.
No, you can't. I've been very fortunate that I have a great, number one, I have a great leadership team. We have phenomenal teachers and also principals and leaders in the district. Our families have been great. And we have a board that's been very supportive. So these are kinds of things that are critical. We work very collaboratively together through this. So if I have to underscore, I think what has to happen is that you need the collaboration of all of your partners to really get through this.
Dr. Thompson, we really appreciate you coming on The Real Story, and good luck with the rest of the school year. Please keep us updated. Come back on the program.
Well, thank you very much.
Thank you. All right, we continue our discussion about COVID's impact on our children. It has taken an emotional toll that can be difficult for kids and parents to navigate. We're going to talk with State Representative Liz Linehan, co-chair of the Committee on Children, and Ben Shaback, a social worker in Cheshire Public Schools, to see what resources are there to help and to give some practical advice for families that are struggling. Stay